New Mexico health officials are hoping the state's summer COVID surge has leveled off now as we top 21,000 confirmed cases. But one thing the state hasn't seen yet is a surge of new deaths from those cases. News 13's Chris McKee explains.
Yeah, well, the state's average of new cases per day nearly tripled between June and late July, from around 100 cases to more than 300 new cases each day. Hospitalizations and death rates haven't climbed as fast.
We believe actually it's the demographic changes we presented, and I'm not going to do them again today. The fact that more younger people are getting COVID infections, a lot more in the 20 to 30 age group, and actually quite a few more in the 10 to 19 age group as well.
Now, the graphic you see on the screen there shows case numbers in green, hospitalizations in gray, and the deaths in red. Well, Dr. Scray said last week it is encouraging that younger age groups have had fewer hospitalizations and less serious complications. That does not mean they cannot pass the virus to people who could fall far more ill or die. 655 people have died from COVID so far in New Mexico. The state estimates for every confirmed COVID case, they believe there's another 4.6 people who get the virus, but either don't know or don't get tested, so they're not part of that official count. By that figure from the state, it means that an estimated 118,000 people in New Mexico have likely caught COVID, roughly 5% of the state's population of more than 2 million people.
But it takes 70% of people being immune to really have herd immunity.
Dr. Scray says that coronavirus is now thought to have around a 1.3% death rate worldwide. Now in New Mexico, about 3% of all people with confirmed cases have died. Factor in the number of estimated unconfirmed cases, and that rate drops to 0.5%. Back to you.
All right, thank you, Chris. New Mexico's estimate of 4.6 unconfirmed cases for every confirmed case is on the conservative side. The CDC believes there could be anywhere from 5 to 20 times as many unconfirmed cases as confirmed ones. The state is reminding people to answer your phone as they try to track down people with a possible COVID exposure. The Department of Health says it's about a 50-50 chance that someone answers the phone the first time the state calls them for contact tracing. Workers leave voicemails and keep calling until they get a hold of a person. The state has even launched a new TV ad encouraging people to pick up.
We need to be able to have more people to be able to do the job. But, we ask the public to help us help you, please, and, do everything that you can to be able to slow the spread of this.
Right now, it's taking more than 2 days on average to get in touch with someone and recommend quarantine. The goal is to get that window below 36 hours. The health department has 260 tracers and tries to bring in another 25 every week. We do not have a full report on today's new COVID-19 cases because of a technical problem at the state's reporting lab. The partial results included 117 new cases, with the biggest increases in Doña Ana, Bernalillo, and Lee counties. The rest of today's numbers will be included in the daily report as soon as they are available. New Mexico is up to more than 21,000 cases, with one more death, bringing the death toll to 655. About 130 people are in the hospital, and at least 8,400 have recovered.